Hi everyone, I'm Dr. Tehsim Memon. So today we are going to discuss CVA or cerebrovascular accident or also known as stroke. Okay, this is we are continuing our neurology playlist. Okay, so today we are going to discuss just the introduction and the blood supply of the brain. Okay, so first of all, what is the definition of cerebrovascular accident? So as the name suggests, it has vascular in it. So then that means that there will be a vascular problem. Okay, so the definition has three words. First of all, abrupt or acute onset. Okay, there is first word. Second word, it's a neurological deficit. Obviously, it's related to brain, so it will be a neurological deficit. And as I told you, the name itself has vascular. So this neurological deficit we will attribute to a vascular cause. Now, what does that mean? Okay, what does this mean? So we are going to discuss a little bit about it in the next slide. Okay, so first of all, brain is supplied by three main vessels. Okay, that we'll discuss in the next slide. This supply is very important. There are three major vessels and there are lots of minor vessels. Okay, so there is a extensive anastomosis in the brain. Okay, so if there is a vessel of occlusion or obstruction anywhere in this major arteries or in the small arteries, this will lead to first of all ischemia. Okay, so ischemia is just decreased blood supply. Okay, still there is there is no death of the brain cell. This is ischemia. If this occlusion remains for seconds, and again if the vessel is revascularized, then ischemia will be temporary and it will resolve itself. Okay, but if it prolongs for even minutes, okay, there is a rapid brain cell death. Why this happens is why within minutes there is a death of brain cells is because brain doesn't have glycogen. Okay, it relies on glucose extensively. Okay, so if there is ischemia for even few minutes, glucose supply will be over, and then there will be cell death. This is what we call infarct. Okay, this is what is known as infarction. Okay, so the definition here will summarize abrupt acute. This will be acute or abrupt onset of neurological deficit. Due to this infarction, there will be neurological deficit. Okay, and it is attributed to vascular cause. So this is basically the summary of the definition of the CVA or stroke. Now, if within 24 hours this neurological deficit is resolved, it is known as TIA, transient ischemic attack. If it remains, most commonly this is less than 1 hour. The symptoms are less than 1 hour. If it remains, the symptoms remains more than 24 hours, okay, then it is known as CVA or stroke. Okay, I hope I am clear here. And the symptoms here will be related to the vessel supplied because each vessel is supplying a specific region in the brain. So the symptoms will be related to the type of the vessel or the vessel which is involved and which area is involved. Okay, so this will be, that's why it is important to understand the blood supply of the brain. Then only you can, when you understand the brain supply of the brain, blood supply of the brain, you will understand the area they are supplying and that area, what function that area has. This, then only you can know that what can be the symptoms of the stroke or TIA. Okay, in TIA, CT or MRI, the investigations will be normal. In stroke, it won't be normal. Okay, so this is again another differentiation. So basically, the definition of this definition is of CVA is clinical. Okay, as you can see, all clinical. You don't need investigations for diagnosing stroke. Okay, but To confirm the diagnosis, you need investigation, and mainly we use CT or MRI brain. Okay, so this we'll discuss in another video. So now this is what we are going to discuss about blood supply. So cow means circle of Willis. Okay, so circle of Willis is an extensive anastomosis that is present on the base of the brain. As you can see, this is the base of the brain. Okay, and how the supply will discuss in next slide in detail. So as you can see, this is a base of the brain where there is a anastomosis. Okay, so here is a here is the PCA, that is posterior cerebral artery, and this is anterior circulation. This is the posterior circulation. I'll discuss in the next slide. So first of all, the supply of the brain, arterial supply of the brain is divided into two parts: anterior circulation and posterior circulation. So basically, circle of Willis is the anastomosis of this both circulation. Anterior has two parts: ACA and MCA. MCA is a branch of, both are the branches of ICA only. AC is a branch of ICA, MCA is continuation of the ICA in the brain. Okay. Posterior cerebral artery, PCA, anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. So now here we'll understand how posterior cerebral artery is formed. Okay, so as you can see, there are two vertebral arteries. Okay, this vertebral arteries will supply the vertebra, and then they will go enter the foramen magnum and in the brain. Okay, there in the brain they will form two vertebral arteries, right and left, will form a single basilar artery. Okay, this basilar artery is divided into two parts: posterior cerebral artery, and this is your posterior circulation. And as you can see, ICA is continuing as MCA and it is giving ACA branch. Okay, and both the ACA in anteriorly is communicated, like connected by each other with each other by anterior communicating artery. Okay, now this posterior communicating artery is the one which is connecting both anterior circulation and posterior circulation. Posterior communicating artery is the branch of, again, ICA. Remember this. This is a very important point. It's a branch of ICA. Okay. So this is the communication between the anterior and posterior circulation. Anterior communicating artery is the branch of ACA, but posterior communicating branch artery is the branch of ICA. So this is the circle of Willis, that is very important. So as you can see in this picture now, this is your two vertebral arteries. This is your vertebral arteries, that is in at the level of pontomedullary junction. It will become a basilar artery, which will be a single artery running medially in the pons. Okay, at the junction of midbrain and pons, it will divide into two parts: posterior cerebral artery. Okay, and there is a posterior communicating artery here. This is posterior communicating artery, the small one. Okay, and this is your anterior circulation. This is your ACA. Okay, so this anatomy is very important to understand the stroke further. Now this are the what now this was the anastomosis that is present in the brain. What does it supply? So main thing you have to remember is ACA, MCA, and PCA. Okay, ACA mainly supplies medial part of cortex of cerebral hemisphere. Medial part of cerebral hemisphere. MCA supplies lateral part of the cerebral hemisphere, known as cerebral cortex. PCA supplies posterior fossa of the brain, mainly parieto-occipital lobe. Okay, vertebral artery and basilar artery are also important for posterior circulation. Basilar artery will supply mainly pons. Okay, pons and cerebellum. And vertebral artery gives pica. Okay, so both vertebral artery and pica supplies medulla. Remember this, very important. Okay, so as you can see in this figure, the medial part is by ACA. This is ACA. Middle cerebral artery, MCA, is supplying the lateral part. Okay, not just cerebral cortex. Cerebral cortex plus the subcortical structures will also be supplied by MCA, but lateral part, medial part, is by ACA. Okay, Right. Now, this is subcortical structure that is again supplied by the deep branches of MCA, and this is supplied by PCA, right, posterior part. So I hope this is a good picture you are having. Again, this is the same thing that I told you. This is MCA, this is MCA, okay. Laterally, MCA will divide into two parts, superior and inferior, okay. Just this is important, bifurcation of the MCA into superior and inferior division, okay. Inferior part will supply the temporal lobe, superior part will supply the lateral part of frontal and parietal lobe. This is medial part, which is supplied by ACA, as they have written here, it is supplied by anterior cerebral artery. Why this is important? Because MCA, the lateral part of the cerebral hemisphere, is responsible for low supply of nerve supply of lower part of the body. Okay, and sorry, so MCA, lateral part of the cortex, is responsible for nerve supply of upper part of the body, and ACA, that is medial part of the cerebral hemisphere, is responsible to supply blood to supply nerves to the lower part of the body, that is lower limb. So depending on if ACA infarct is there, if ACA is occluded, then the medial part of the cerebral hemisphere will be infarcted, and because of that lower limb weakness will be more than upper limb weakness. And if MCA is occluded, then this is just a general idea. If MCA is occluded, then the lateral part of the cerebral hemisphere is affected, and so there will be weakness will be more in upper limb than lower limb. So this becomes the basic of understanding the clinical features of stroke. Basically, when patient comes to you, first thing you have to diagnose is how will you diagnose clinically. Then there comes the investigation. Stroke mainly needs clinical diagnosis because the treatment has to be urgent. If you revascularize the occluded vessel, it will be very helpful for the patient, and patient can be recovered easily. Okay. So thank you so much for watching my video. If you like it, please click the like button, share and subscribe. Thank you.